Good evening and welcome. My name is Deborah Marshall. We're so grateful that you could join us. This has been a wonderful couple of days. Last night we sponsored a gathering with the Emergency Medical Services team, and I'm sure that some others will comment on that, but it was an extraordinary event with so many people coming and viewing this for the first time and really realizing what an exceptional gift this is to our community, to our staff, and to all those people who work so hard to make it a realization. We've had a lot of people that have contributed to the success of this evening, and we want to celebrate all of that. This morning we had a dedication with our employees, and you know, it really buoyed their spirits, because when you talk about healthcare, sometimes you hear only the negative stuff that's going on. But there are people that work day in and day out in our facilities, and they work very, very hard to make the patient experience special. And so coming together today in a Catholic institution on Ash Wednesday was very, very special for the teams that gathered, because we not only gathered as one, but we also went through and blessed every single room in this phase 1 expansion. So that was very, very memorable. And then we opened wide our doors for the public to come in and view us. And so we said, community, here we are. We have arrived. This is a wonderful time in the history of our organization. And so that was this afternoon. And then the wonderful culmination of a day's activity is having you here as our guest. We have some very important people that we need to recognize and ask to come to the podium. And first is our leader, Philip Patterson, our Chief Executive Officer.
It is my sincere honor and privilege to be up here, not on behalf of myself, but on behalf of the team here at Good Samaritan Hospital, as well as Charity Health System. I knew when I started 3.5 years ago and I walked through that emergency department, the dire need for this hospital to have a different environment with which to treat the critical emergent needs of this community. And over that time, we've done a lot to improve and actually expand the capabilities of the doctors in our emergency room under new leadership with Dr. Wasserman as we continue to expand there. And we've brought in Linda Dietterich and totally revamped the nursing department as it stands and all the support services down there, so that in anticipation of tonight, we would have the technologies and the talents to mimic what we're about to open in the form of a building, because we know that a beautiful building is just that, a building. But it is the appropriate setting for us to be able to take care of the patients who need us most in their time of need. So it took me a little longer than I thought it would, but then I learned that's the way it works in New York State. But I appreciate all of the leadership and the thinking that went into what we see and what we're standing in today. I have to thank the Charity Health System Board for their vision and allowing me and the leadership team to embark on this critical need for our community as well as this hospital. I think this is going to lead to so many exciting and new things for this hospital, as it is just really the first of many expansions that we have on the campus over the next few months. So we're excited about that. But I also have to take a moment to thank the Good Samaritan Foundation Board, myself, their tireless work in helping us to raise funds to make this happen. What we're standing in, as well as what will happen starting Monday and be complete hopefully this summer, is just under $19 million in renovations. That's a big paycheck, and it could not have been accomplished without the hard work of Stacy and the group, the people on the board, and those in the community who have donated to this cause, as it is a need. I also have to say thank you to everybody who helped in sealing the grant that we got from the state of New York. We did receive almost $3.3 million from the state of New York, who saw that this vision is actually a need in this community. So when you reach out and show the dire need of the community, the state was willing to help. I would again like to mention all of the employees and the physicians who we recognize today. and their help and they're really what's going to make this emergency room work. So I'm very excited about that. I want to thank the construction crews. I want to thank Jack Holt and Holt Construction. What a beautiful, beautiful building. Thank you very much. I would like to also mention the workers that made this, all the subcontractors, the unions, the IBEW, and all of those who have donated their time and talent and treasure to this organization as we move forward. They had a critical piece in that for us, and we're excited to have them there. This will definitely enhance the patient care and the patient experience and the ability of this system to grow and meet the needs of Rockland County as well as the surrounding counties as they continue to grow, both in size and in need. So, again, thank you very much, and I appreciate everybody who helped us get to today. This is just the first step, so it's an exciting day as we move forward in the future of Good Samaritan Regional Medical Center. So thank you again.
The work and effort and labor of love that has existed for the past 18 months really has come to fruition. I would like to thank Maria Santini for her project management and her tireless efforts. She really did come to bring everyone together, all the contractors, everyone in Holt Construction, and all of the nursing staff to make sure that this was tailored to the individual needs of patients going through the most difficult time probably in their lives when they enter a hospital. I'd also like to thank all of the medical staff and the nursing staff, especially the disciplines that helped us pull this together with all of their input. Today, what we saw was a renewed commitment to Good Samaritan Hospital from everyone in the institution as well as the nursing staff, and the pride that they showed that this is a new beginning for us. And last night, most of the EMS workers said to us, the driver said, "We can't wait to bring a patient here." And I responded, "I can't wait for you to come here." And that was everyone from the region. They also said that this was the best regional emergency room that they have seen in a very long time.
We have done a major 360. I mean, the whole ED is completely different. The personnel, everybody is so engaged, and this is why, because we're here for all of you, and we're here for our community. So now, it's what an honor to be here now to see this. I couldn't wait for the doors to open up. So now we have one more session to go, and then we'll have all the new ED. So I just can't, from the bottom of my heart, say how much I appreciate everything.
We are so ready to get in here and start serving Rockland County, giving them the space that they deserve, the care that they deserve. And the people that make that happen are our incredible staff, our doctors, our nurses, all of the nurses, our physician assistants and our nurse practitioners, our support staff, our x-ray techs, our lab people. And I have to say that the medical staff at large has been so supportive. We could not do this without their hard work, and I cannot tell you how happy I am to be here and be part of this today. Thank you.
The last official job that I have tonight is to lead a toast for the new emergency department, and I thought that it would be a good opportunity. Deborah mentioned the long history and mission work that we've had with the Sisters of Charity for over 100 years. And in co-sponsorship with that is the Bon Secours Health System. So I thought I might take a page from their ministry and lead a toast with this. They have a ministry saying that says, "We are Bon Secours. We are on holy ground. We are here to do good help for those in need." That's what this is about. Toast.